Thank you for joining us in a very sensitive topic. It's women's intimate health. I'm Dr. Janet Allenby. We have Tanya, who is one of my expert technicians in this area, who are here to kind of help you understand what is all involved in women's intimate health treatments. First, let's talk about what does women's health entail. And why did I bring it in the office? I'm a dermatologist. I really brought it in the office because I had some problems. Once you hit menopause, and I don't think you truly get to be in menopause until you have some sort of symptoms in your intimate area, otherwise known as the vagina area. So as you age, you start thinning out in the tissue, and you sneeze or you cough, and all of a sudden you pee a little. It's like, what just happened? It's just part of aging, but it is something that we all eventually get to, pretty much. I would say there's probably a few lucky ones out there, but most people are not that lucky. So what happens is you start losing some of the estrogen that supports the tissue, and the tissue starts getting just not supportive anymore, so it doesn't hold the urethra up, which is where we pee from. So that is why people tend to start having part of the sneeze and pee, cough and pees. The other thing that happens is, especially if you have babies, you start losing the musculature in the pelvic floor. It's kind of like this little basket that holds everything up, and as we age, it kind of gets lax like everything else. So those are two big areas that we address in the office when we're doing women's intimate health treatments. So this device actually does both of those. We do recommend a lot of women who, if you're not already on hormones and you need hormones, you probably should be on them. They also kind of assist in getting that skin a little bit thicker. But these are machines that actually help repair the tissue and also repair some of the muscle that we've lost over time. So I have Tanya because I really think it's such a weird area for people to talk about openly, and it can be very uncomfortable for a lot of people. But it really is something that a lot of us, we experience it. If you're having vaginal dryness, if you're having painful sex, these are symptoms that kind of happen to everybody as you get older. You don't even want to be intimate anymore because it's uncomfortable and it's just not fun anymore. So these are things that we can address, and we're going to go through them. And kind of what would you expect if you came in our office and you had a treatment? So first of all, they come in and we have a special area, and it's actually a little more intimate than we have it here, but it's a nice area that is quiet. We block it off so nobody's going to go walking in your door, and it's very relaxing. We keep the temperature nice, and we have you lay down and we do this treatment, and Tanya will explain the treatment. And I just want to kind of take away the fear of what's going on, because it's like, this is embarrassing and it's weird, and it's not. I mean, she's treated me and it definitely helps, and that's why we're talking about this, because if it doesn't help in here, you never get to see it. So the Votiva has been a machine that has really been very effective in building up muscle and building up the tissue that we're having a problem with, which is the vagina area. So Tanya, we have a patient who comes in. What do they expect? How they sign in at the front, and what happens after that?
I take you and I put you in the room, close the room. It's a private room. It's nobody coming. And we talk about the problem. What the most bothering you? So you can tell me. So it's you have dryness. You have some laxity. Yes, and I can tell you about this device. This is called FormaV and VTone. The FormaV. This is device. It's vaginal rejuvenation. So it's treat internal and external.
Yeah.
It's not painful. It's maybe a little bit.
Right. None of these are painful. Yeah, we don't like anything painful down there.
No.
So as you can tell, it's kind of shaped like a tampon, and it's shaped like the vagina. We use this internally and externally. So dryness happens from the inside mostly, so you definitely have to get the inside treated. But let me tell you, we do the outside and you'll look like a little teenager. It's pretty good stuff. Somebody's obviously done it. So this is not painful. Okay, so we have a, these are throwaway tips every time. You have the tip that's brand new on there. Tanya, get you relaxed. We use like warm ultrasound jelly when we work, which makes it all much more comfortable. Nothing is uncomfortable at all because, again, this is such a scary procedure if you are new to this discussion. You know, some people are very open and want to talk about it, and some people are very private, and I think it scares them a lot. So I gotta say, you know, definitely for vaginal dryness, if you're having a little sneeze and peeing, if you're having painful sex, I actually would say the men kind of like the women who do this a lot. So a lot of guys are very excited for their wives to have this procedure, and I know that sounds just awful sexist wise, but the guys are, you know, that they're supportive of their partner having this done because you know, it's a thing for the relationship. It's something to make the relationship continue to be as good as it was, or maybe to make it even better. So this is the device that actually tightens the tissue. Okay, its heat is coming from this, and it's basically you're moving it around. So Tanya is going to be moving this around, which is a little bizarre feeling, I gotta tell you, but it's not uncomfortable. And she'll talk to you. I know she tells me about her grandbaby.
They have a blanket. They cover like.
So it's
almost
very,
yes, it's very privately. It's nothing scary.
Yeah.
Yeah, and also it's like they stimulate your own collagen.
Yeah.
So because it's a heat, it's your collagen start growing and it's tight your tissue.
So this is radio frequency, and for those who are in aesthetics, they know radio frequency. We use it a lot to make collagen grow. Not only is it growing, it's rejuvenating the tissue. Cells are kind of waking up. They're little cells that were not talking to each other start talking to each other. So it really does help having a device that is very gentle, but going to create collagen stimulation, building up that tissue again, helping the body actually act younger, which so that means you're going to get more lubrication, which we definitely have a lot of dryness problems as we get older. What's our other device that helps?
Called VTone. So this is muscle stimulation. So we also we put inside and it starts to stimulate muscle and your muscles start in contraction. So it's like exercise.
Yeah, it's basically Kegels on steroids is what this is.
Yes.
So those people who do Kegels, they know what we're talking about. For those who've never done a Kegel, you're going to find out what a Kegel is. This, is put intravaginally and it does a contraction. How long are they going to be on the treatment for?
Like 30-40 minutes.
Okay, so bring a book. You can relax, you can go to sleep. I think in the beginning, it's a little bit weird. It's a little oh.
Yes.
We actually, she's going to put it in and leave you. So basically you're in there by yourself with this device, just giving continuous contraction to build that muscle back up. Mm-hmm. So, it is something that sounds weird, but it's pretty simple. At the end of the day, you have muscle stimulation, you have a device that's going to tighten up the collagen, build you up a little bit, start getting those cells acting younger.
Yeah, and also we have the couple levels of energy.
Oh.
So the patient can,
regulate
what they can tolerate, the energy, and they can do,
right.
Make
and everybody is different.
Energy.
You don't have to go to the top number. It's actually people who are in better shape tend to not do as well at really high numbers. People that have a little more laxity issues of their muscle might start at a higher number than somebody who's in a little better shape, just FYI. So don't go for numbers. There's never a race to the numbers on that. It's whatever you're pretty comfortable with. If it gets where it's a little uncomfortable, then we just turn it down a little bit. So we find your level, let you sit. Tanya covers you up, you're back, we let you sit out, hang out for a little bit, she pops back in. If you want to try a different level, you can go to a different level. Now, how often would we be doing these?
So the Forma, it's usually 4 weeks apart.
Okay.
It's once a month.
How many times?
It's 3 times.
So it's not bad.
Yes.
Okay, so you're going to do 3 times monthly. Then you're going to want to do it over time. So maybe in 4 months you do 1. In 6 months to 8 months you do another. You're going to have to gauge yourself. Everybody's different, and sometimes you may have to do it a little more than you would expect. Some people actually can spread them out further once you get past the first 3.
Yeah, and the VTone, if you just started, it's better if you're doing once a week. So it's 6 treatments once a week, and when you're done, of course you can do
Yeah.
once a month, like, or like couple months.
Right.
Yes.
So it really kind of depends on your schedule, what you're, are you in town, things like that. So we do try to get probably within 4 to 6 weeks is usually that number for the Forma, which is the one that actually Tanya or one of the staff members is with you the whole time and they're working on you. And we're going to show you some pictures, and they are really great pictures, I gotta say, which is kind of weird. But really, it's fun because we really do help people get their sexual life back, make them feel better, give them that confidence. When you go jogging, you're not having like, what happened here? Those are huge life impacting events that you just don't feel as good as when you were younger. So if we can get you back to that younger self, that's what women's intimate health is all about. Now, we have 2 awesome treatments, and I gotta tell you, personally, I use everything that I can to make things better. And if I have one problem, which is vaginal dryness, I cough and I pee, those sort of things, I also have problems with my muscles. So I would tell most people they really need to do both of them. You don't have to, but using them in combination is going to get you much better results at the end of the day. So, it's really up to you. And sometimes when the dollar is a little bit being stretched, maybe we stick with the thing that you're having the most symptoms for. So if it's vaginal dryness, maybe we'll start with the Forma. If you're having a lot of problem with like peeing, sneezing and peeing sort of thing, we go more with the VTone. So everybody's a little bit different. If you've had a lot of children, sometimes
No,
the
I
VTone,
think the young people who have the children, this one is the best.
See, there you go.
Yeah, to make like the muscles go back to normal.
Yeah.